to know now.
The time to listen is now.
KNX KRTH FM HD2 Los Angeles.
KNX 1070 News Radio. Depend on us.
An Odyssey station.
Well, it's called Elevating the Safety Net. It's a 5-year, $155 million initiative to recruit primary care physicians who can start their careers by working in underserved communities.
The pandemic has put an additional strain on an already existing shortage of physicians in the United States, a shortage most often reflected in underrepresented communities. So the LA Care Health Plan Scholarship Program was established to try and help alleviate the problem.
When we established our scholarship program under Elevating the Safety Net, we were trying to address the challenge of having physicians in our network that represent and reflect our members in our Medi-Cal programs.
Cynthia Carmona is Senior Director of Safety Net Initiatives at LA Care. She says the hope is that the medical students chosen for this year's scholarship program will begin their careers in underserved communities as primary care physicians without the burden of having hundreds of thousands of dollars in loans to pay off. Nathan Roberts, KNX 1070 News Radio.
When you need to know now.
The time to listen is now.
KNX KRTH FM HD2 Los Angeles.
KNX 1070 News Radio. Depend on us.
An Odyssey station.
There's a great need these days for new physicians here in the United States, and most especially primary care physicians who can spend at least a part of their careers working in underserved communities. And in order to address that shortage, LA Care Health Plan established a scholarship program and worked with UCLA and Charles R. Drew University of Medicine and Science.
So we worked with them to establish criteria where we seek out individuals wanting to go to medical school who have financial needs, who come from underrepresented backgrounds, who have an affinity for our Medi-Cal member type population. And that's who we have been able to recruit into these programs.
Cynthia Carmona with LA Care says this year's scholarship recipients reflect those values and will hopefully begin their careers as primary care physicians in underserved communities without having to pay off the hundreds of thousands of dollars that most medical students do face.